Introduce yourself and verify the patient's identity.
My name is Carla. I'm going to be your nurse today. Can you tell me your name?
Lin Chow,
Great. And your date of birth?
January 6, 1983.
All right, great. It matches your...
Explain the procedure to the patient and discuss how the results will be used.
I have a new order from your doctor to start an IV. Do you know what that is?
No.
Okay, well that's where we put a catheter into one of your veins, either on your hand or up here on your forearm, so that we can give you medications through that without having to stick you over and over and over.
Okay. Sounds good.
Yeah, so it gives us a route to give you medications, okay? Have you had any allergies, any bad reactions, anything like that?
No.
Okay, all right, good. I'm just going to wash my hands and then we'll get started.
Gather all of the appropriate equipment. Perform hand hygiene and observe other appropriate infection control procedures.
Instill normal saline into the IV extension set or saline lock.
Prepare your patient. Assist your patient to a comfortable position. Place a towel or a bed protector, such as the chucks, under the extremity to protect the linens. Dilate the patient's vein. Place the extremity in a dependent position. Apply the tourniquet firmly 6 to 8 inches above the venipuncture site. Explain to the patient that the tourniquet may feel tight. Encourage the patient to clench and unclench his or her fist. You may lightly tap the vein with your fingertips. And expose the limb that you are going to use, but make sure that you are still providing privacy for the client. Select your venipuncture site. Use the patient's non-dominant arm if possible. Identify possible venipuncture sites by looking for veins that are relatively straight. Apply clean gloves and clean the venipuncture site. Clean the skin at the site of entry with a topical antiseptic wash. Use a circular motion and move from the center outward for several inches. Allow the solution to dry on the skin.
Prepare your saline lock tape.
Apply the tourniquet firmly 6 to 8 inches above the venipuncture site. Remove the catheter assembly from the sterile packaging. Use your non-dominant hand to pull the skin taut below the entry site. Hold the over-the-needle catheter at a 15 to 30 degree angle with needle bevel up. Insert catheter through skin and into vein. Hold the needle assembly in a steady manner. Advance the catheter until the hub is at the venipuncture site. Release the tourniquet. Carefully remove stylet and engage the needle safety device and immediately put pressure on the vein proximal to the catheter to eliminate or reduce blood oozing out of the catheter. If a hematoma occurred, release the tourniquet, remove the needle, and apply pressure. When saline lock is attached to the hub of the catheter, flush the catheter with normal saline to ensure a smooth flow. Place sharps directly into sharps container. Tape the catheter using a tegaderm. If preceding steps fail to distend the vein, remove tourniquet and wrap the patient's extremity in a warm, moist towel for about 10 to 15 minutes. You may also minimize insertion pain as much as possible by using ice or an intradermal injection around the site that you're going to venipuncture. You may apply a padded arm board in order to splint the joint that has the venipuncture site within it.
To secure the saline lock, you may use a chevron style of taping or loop the tubing with tape.
Label your venipuncture site with the date, time of insertion, type and gauge of catheter used, and the nurse's initials. Discard tourniquet, remove gloves, and discard gloves. Perform hand hygiene.